Repair umbilical hernia, younger than age 5 years, reducible. Incarcerated or strangulated. Repair umbilical hernia, age 5 years or over, reducible. Incarcerated or strangulated. The physician makes an umbilical incision. The hernia sac and facial defect are identified and dissected from surrounding structures. The hernia sac is opened and the contents of the sac are examined. If the contents of the hernia sac are viable, the hernia is reduced and the hernia sac may be resected. The hernia defect is closed with sutures. The incision is closed. Repair initial inguinal hernia, full-term infant younger than 6 months, or preterm infant older than 50 weeks post-conception age and younger than age 6 months at the time of surgery, with or without hydrocelectomy, reducible. Incarcerated or strangulated. The physician dissects in the pre-peritoneal plane to present the hernia ring. The physician applies manual pressure to the inguinal region from outside while trying to dissect the hernia sac to reduce the hernia. If that fails, which can occur when there is a discrepancy in size of the hernia compared to its contents, the physician enlarges the hernia ring by an electrocautery incision in a ventral direction. The incision is made in a ventromedial direction for medial hernias and a ventrolateral direction for lateral hernias. The hernia is reduced using pleural insufflation of carbon dioxide. If a hydrocele is present, it is incised and drained. The hernia defect is repaired by suture and reinforced by staples or mesh. If, in the case of an incarcerated or strangulated hernia, the physician empties the contents of the hernia sac, places the contents in the lower abdomen, and repairs the hernia defect by suture. Repair initial inguinal hernia, age 6 months to younger than 5 years, with or without hydrocelectomy, reducible. Incarcerated or strangulated. Repair initial inguinal hernia, age 5 years or over, reducible. Incarcerated or strangulated. Repair recurrent inguinal hernia, any age, reducible. Incarcerated or strangulated. The physician makes a groin incision. The hernia sac is identified and dissected free of surrounding structures. The hernia sac is ligated and resected. If a hydrocele is present, it is incised and drained. The groin incision is closed. For incarcerated, the hernia sac is opened and the contents of the sac are examined. If the hernia contents are viable, the hernia is reduced and the sac ligated and resected. Repair initial incisional or ventral hernia, incarcerated or strangulated. Repair recurrent incisional or ventral hernia, incarcerated or strangulated. The physician makes an incision over the hernia. Dissection is continued through scar tissue and the hernia sac is identified and dissected from surrounding structures. The facial defect is identified circumferentially. The hernia sac is opened and the contents of the sac are examined. If the contents of the hernia sac are viable, the hernia is reduced and the hernia sac is closed and may be resected. The hernia defect is closed with sutures. The incision is closed. Implantation of mesh or other prosthesis for open incisional or ventral hernia repair, or mesh for closure of debridement for necrotizing soft tissue infection. The physician implants mesh for a separately reported incisional hernia repair. The hernia defect is closed with mesh or some other prosthetic material. The incision is closed. This code is listed in addition to an incisional or ventral hernia repair and is not subject to modifier -51 or reduced.